Hey Acupressure and Wellness fans, it's Diego Roig, and in this short video I wanted to address a question a viewer had sent in regarding wrist pain. And this is in particular pinky finger side wrist pain, also known as ulnar wrist pain. And I would like to show you just one technique, one easy technique that you could use to treat ulnar wrist pain that's coming from your forearm. So wrist pain can have many causes. Trauma, acute trauma, you fall and slip and you put your hand down to brace yourself. And what happens is you injure your wrist. It can be from repetitive strain, for example, carpal tunnel syndrome, excessive computer work. Wrist pain can also come from activities that involve gripping and twisting. So there are many sports which involve gripping and twisting. Softball is one of them. You've got baseball, using a trowel in the yard, tightening something with a screwdriver, gripping and twisting. These motions can actually cause wrist pain, not because they're injuring the wrist here, but because they involve these large muscles in the forearm called the extensor muscles. And these extensor muscles tie in from the elbow, they come all the way down to the wrist. When they get tight, they entrap trigger points. And remember, they also compress on trigger points. So tight muscles form into knots. They entrap nerves and compress nerves. And then what happens is you feel a radiating nerve sensation down the nerve pathway. So if these forearm muscles are connected here and down here in the wrist, what happens is you will feel, when these get knotted, you'll feel nerve sensation going down the nerve pathway. So what I want to do today is just point out 3 common trigger point locations, and these are located on 3 different muscles. And all you need to know is just the general location of these. And then what you can do, it's like when you go to visit a friend and they give you their address and you go, you're not worried about it. You're like, yeah, just give me your address and I'll find you. And so an address puts you in the general vicinity. When you get there, then you start looking for details. So same thing with these trigger points. These trigger points here, there's one out here and there's 2 over here. And these are their general locations based on your anatomy, your size, and how you use your body. They can float around and be in slightly different locations, but they're easy to find. You just go to these general areas, okay? In this case, these 3 general areas, and I'll show you in more detail. But as you feel around, you're going to feel for, that tightness, that muscle tension, and the whole area may be tight. Feel for the most tender spot, the tightest nodule or knot. That's where you're going to feel for, and that's a trigger point you're going to work on, and that's what we're going to work on today. And I'll give you one simple technique to treat that point. And for this technique, I'm using either a tennis ball or a lacrosse ball. These both are great. A tennis ball is softer, so if you're someone who wants more pressure, you've got bigger, stronger forearms, you want more pressure, then you'd use a lacrosse ball. If you're someone that you're lighter frame and you'd like lighter pressure, then you could use a tennis ball. And what we're going to do is we're going to basically press on these trigger points, the same technique that I showed you where you hold the point for 12 to 15 seconds. You're going to hold that spot. And after 15 seconds, then you're going to slide over back a little and do that again for 15 seconds. You're going to go down. You're going to go all over where the trigger point is located, and you're going to see if you can release the whole trigger point by catching it from different angles and stuff, okay? While you're doing that, as you're counting 12 to 15 seconds, as you get kind of towards the end, you want to move your hand a little here, and I'll show you what I mean by that. What that will do is that will break up the scar tissue and tightness around that knot and free it up so you have better range of motion with your wrist, and we decrease the frequency and intensity of that radiating nerve sensation. Okay, now here are the 3 trigger points I'm talking about. These are the hand extensor muscles, okay? And you can see the image there. The X is where the trigger point is. The red is where it radiates to. And now we're talking about this particular one here, okay? The trigger point on the outside of the forearm. So I just want to show you a diagram right here. And in this diagram, these colored muscles are where the trigger points are. And they're generally located there, there, and there. These are the 3 trigger points we're going to cover today. The technique I want to show you, now you can do this on the floor if it's more comfortable. You can do it at your desk. I'm going to use a wall, and for this demonstration I'm going to use a lacrosse ball. So what we're going to do is we're simply going to take this lacrosse ball and find that trigger point. In this case, for that ulnar wrist pain, these trigger points, you want the outside trigger point, the green one. This is the one, the ulnaris. This is the trigger point that we're going to work on that refers pain to that outside trigger point area, the outside wrist, pinky wrist area. So we're going to take our lacrosse ball, place it at a height that's comfortable, and then bring your forearm. Now you notice the trigger point, here's the bone. There's this big kind of thick sausage-like muscle right above the bone. That's the muscle the trigger point is on, okay? So you kind of you locate where that bone is and you come right above it, and you're going to be on that belly of that muscle. This is what I'm going to do here. And then you lean into the wall, get it at a nice height so your shoulders aren't tight. You're nice and easy. You're just basically, all you're doing is pressing into the muscle, and you find how you make yourself comfortable, and then you push into it here. Just drop your weight, and you're going to count 12 to 15 seconds. As you approach 12 seconds, what you can do is you can open and close your hand like this, nice and slow. You can do figure eights with that hand. And then you can stretch the hand this way. And go up and down. And when I'm doing that, I'm feeling nerve sensation shoot down to my wrist. So if you have wrist pain that's coming from tight forearm muscles and has nothing to do with the structures and anatomy of the wrist. Now the wrist has, I think it's 24 bones, and so it's like a Swiss watch. These bones are set in very specific locations, and it may be perfectly fine, your wrist may be perfectly fine, but that pain you're experiencing is coming from these big muscles here, and they're tight, and they're pulling on those little wrist bones, and they're kind of moving them out of alignment, and they're also radiating nerve sensation. If that's you, try treating all of these trigger points, the 3 that I mentioned, but especially the one on the outside, okay? The one on the outside where that green is. That's the guy you want to work on. Find it on your own, just palpate around, feel for the most tender spot, start there, and using your ball, holding 12 to 15 seconds, treat those areas around there. That's it for today. Thanks for sticking with me, and until the next video, have a great day.